My life had basically what I consider ended. I could no longer do what I wanted to do. I was so incapacitated by the pain in my legs and my hips. I was sent to an orthopedic for actual joint injections. I mean, this just went on and on and on, and it got so bad I was literally dragging my left leg. Finally, the orthopedic sent me to Dr. Bovinet, and he says, I think it's your back, and I want an MRI. So the MRI showed that I had an issue in my lumbar region, and he started describing this procedure he could do. I had already planned a vacation with my daughter. We only get to see each other once a year. And I said, you know what? I don't care if it takes duct tape and super glue. If you can put me together so I can go on this vacation, sign me up. I went for the procedure, and I literally dragged my left leg going in. And when I woke up, I walked across the room like nothing had ever been wrong. I mean, I started crying. This had gone on for over a year. So a week later, I got on a plane, headed for Yellowstone, and met my daughter, and we went hiking. I can't say enough good about it. I have never, ever questioned my decision to have the procedure. In my opinion, it is a miracle.
Minuteman is a minimally invasive implant that we utilize in the spine through a lateral approach. What that means is coming in from the side, and it's differentiated from its competitors in that I could leave all three major spinal ligaments intact. There's one in the front of the spine, one in the back of the vertebral bodies, and one in the very back of the spine across the spinous process. So I don't disrupt any of those with this particular procedure, so I'm not worsening any instability the patients might have. We come in from the side through a small, approximately 1-inch incision, and then we go through fat. And the beauty of that is there's no nerve pain fibers in fat, so the patients can't feel that. Kind of push the muscles gently out of the way, get into that ligament between the spine and the very back of the spine, behind the nerve roots, behind the canal, nowhere near the spinal cord. We kind of lift that spine back up so the patient feels like they're leaning forward, but they don't have to. So instead of leaning over that shopping cart, it's almost like having an internal shopping cart. And the beauty of keeping that ligament intact in the back is when I lift that up, I can't overextend that, that way you're not putting them into too far flex forward, or what a lot of surgeons talk about, or ruining that sagittal balance. We don't ruin that, but we could prevent the worsening of their instability. We could open up the canal indirectly without cutting bones or breaking bones. We could open up that stenotic or narrow canal to effectively have more room around those nerves and more room around the blood vessels too, so they don't have those symptoms that they normally would have with walking. So typically these patients we see, they'd have a lot of pain with standing and walking. Might be leg pain, heaviness, numbness, tingling. That feels better with sitting, leaning forward, leaning in a shopping cart. This could help them alleviate those symptoms in a minimally invasive fashion.